Hi, everybody. This is Dawn Hannon from the Space Coast Health Foundation, and she's going to share with us a little bit of an update on the Affordable Care Act. And probably out of the dozen Affordable Care Act seminars I've been to at different chambers of commerce, I've probably gotten at least a dozen misconceptions. So I'm counting on Dawn to clean some of those up. And we know it's coming, but we need to know how to take care of our employees and then what our individual responsibilities are. So Dawn, here's your clicker.
Okay.
And I'll
Thank
get you a
Rob.
rubber jar opener as well.
All right, need one of those. Thank you, Rob. Hi, again, my name is Dawn Hannon, and I'm from the Space Coast Health Foundation. Probably a lot of you have not heard of the Space Coast Health Foundation because we're relatively new. We were formed 3 years ago as a result of Wusthof Health Systems sold in October 2010 to a for-profit hospital chain, Health Management Association. So the proceeds of the sale of that transaction formed the Space Coast Health Foundation, and our goal and mission is to help healthcare organizations in Brevard County. So the first slide is healthcare reform. A lot of people, the actual name of the act is the Patient Protection and Affordable Care Act. A lot of people call it Obamacare. Same thing. So where we are today in terms of the United States, we have high cost. Okay, our cost per capita or per person is a lot higher than other developed nations like France and Japan, but our quality is down near the bottom. So high cost, low quality. So the goals of healthcare reform, the first is to improve access. So currently there's approximately, and this number changes often, but it's approximately 50 million people, Americans, are uninsured and without access to affordable health care. And another goal is to lower the costs. We have high costs, low quality. And so because we do outspend other developed nations. Another goal is to enhance the quality. Lots of people die every year and get different infections in hospitals. So the goal is to enhance quality. And so where are we going? That's where we are, where we're going. To increase care. A concept that's been introduced is called population management. We'll talk more about that. There's going to be organizations out there that are called accountable care organizations. We'll also look at that more closely. There's going to be what's called patient-centered medical homes, and we'll talk about that, and quality reimbursement initiatives. So providers will be, hospitals and doctors will be reimbursed differently than they currently are. So how this act is going to increase access, or how is it going to ensure that that 50 million or 30 million, whatever the number is, who don't have health insurance, how will this act ensure that they do get coverage? Well, there's a couple different ways. One is Medicaid will be expanded. Now, that's not true in this state, by the way. This is one of the few states where Medicaid wasn't expanded. But in terms of the majority of the country, Medicaid will be expanded. So currently it's based on an income level, and that income level will be increased. So people who make a little bit more will be eligible for Medicaid. The other way is there's going to be marketplaces with subsidies for people who don't have health insurance. They're called exchanges, and starting October 1st, an individual who doesn't have health insurance can go to these exchanges by phone or by email or the web, and you can register or sign up for health insurance, and you'll get a subsidy if you're under a certain income level. And then the third way is by employer-sponsored coverage, and we'll talk more about that in terms of the credits available to small businesses who will offer health insurance to their employees. Can everybody hear me okay? Okay, good. So in terms of access, again, we have approximately 18% of the population does not have health insurance. So out of that 18%, almost 50 million people, the majority of them, or 51%, the blue person, the majority of the people will be in this new Medicaid expanded group. Again, that isn't taking place here in Florida in January 1st, 2014, but perhaps down the road it will. But in most of the other states in the country, that's the case. The next group of people fall into a category where they make a little bit more, and it's called 139 to 399% of the federal poverty limits. So if you make, let's say for example, you're an individual, just one person, and you make, I have that here. I did have it here. If you make, oh, here it is. Okay. Okay, so if you make between 139 and 399% of the poverty limits, you are eligible for a subsidy for health insurance. So that would be anybody who makes $14,000, about $14,500 a year, up until close to 40 some odd thousand. You're eligible for a subsidy, actually almost $45,000. You can get a subsidy when you purchase your insurance from one of these exchanges. And then a small percentage, 10% of that total uninsured population, they make what's called 400% of the poverty limits, which in this case, for one individual, if you make over $46,000, there will be no subsidies available. You're going to pay the full price, whatever that may be. Okay. So that's how they're going to increase access or coverage for those without health insurance. In terms of Florida and Brevard County, Florida has approximately 25% of the population does not have health insurance, so 1 out of every 4. And Brevard County is a little better, 20.7%. Now this is for individuals that are above 65, because over 65 it's assumed you're eligible for Medicare for the most part. Pardon me? Below 65, thank you. Did I say above? Okay. So some of the concepts that are being introduced that are going to help with the access, with the better quality, lower cost, one is a concept called population health management. And my picture up there, it's like herding cats. Not an easy thing to do, but the thought is that individuals will be put into different categories, and their care will be managed based on where they fall. So if you're a healthy person, you don't have any health issues, then really what type of health care you're going to need is preventive. Let's say you have some health risk needs. You have a high blood pressure. Your needs are going to be different than somebody without any health care issues. And then those with chronic conditions, somebody with diabetes, for example, the care that that person will need is going to be different than somebody, a young person without any health care issues. And so that concept is new in terms of you don't just go to the doctor when you get sick, but we're going to manage the population based on where you fall. And the hope is that that will decrease costs because there will be less people ended up in the ER because of being non-compliant, for example, with a chronic health care condition. Another new concept is called accountable care organizations. And what this is, for example, there's all kinds of different healthcare organizations. You have nursing homes, you have rehab facilities, you have doctor's offices, you have hospitals, and everybody does their own business, and they don't necessarily communicate with each other. And accountable care organization is going to be a network of physicians and hospitals, and they'll be providing care to patients. And so it's kind of the example I have up here. It's like when you buy a TV from Sony, you get all the parts. You get the circuit board, you get all the parts. And so healthcare is going to be the same way in an accountable care organization. The doctors will be part of the hospital, that'll be part of the rehab facility, and also, say, for example, skilled nursing facility. So they'll work together. Another concept that is believed will help the patient in terms of quality is each patient will have a patient-centered medical home, and that's typically your family doctor, your primary care provider. And they will communicate with all the other players involved in healthcare to ensure that you don't have duplicate procedures, or that if you do have a healthcare issue, that they're being addressed. And another new concept is quality reimbursement initiatives. So today when you go into a hospital or you go to a doctor's office, the provider or the doctor of the hospital gets paid based on the quantity of services. So if he sees 20 patients, he's going to get paid for 20 patients. Now, they're also going to be paid based on quality. So, for example, a hospital that has a high readmission rate, or a hospital where you come out and you're sick because you caught some acquired condition, a pneumonia, their reimbursement rates will be reduced. So there's that incentive to offer quality as well as quantity. So now we'll talk about healthcare reform in small businesses. Currently, the statistics are that small businesses pay on average 18% more than big businesses for their health insurance. And so we'll talk about how that's going to, these new initiatives will help to reduce the cost and the premium growth. So is the Accountable Care Organization, or Obamacare, some people refer to it as, breaks up businesses into 3 different sizes. The first size is if you're less than 25 FTEs, and FTE stands for full-time equivalent, and we'll talk about that on the next slide. It's not 25 employees. And then the next category is up to 50, and then over 50. So 25 FTEs, what is that? Well, one FTE, and I apologize if some of you know this, some people don't. One FTE is one person who works 40 hours a week, 52 weeks a year. So say they get a 2-week vacation, but they get paid for that. So they work 2,080 hours per year. That's one FTE. So if you have 2 people that are working 20 hours a week, 52 weeks a year, that would be also one FTE. So if all your people, if you had 50 people who work 20 hours a week, that would be 25 FTEs. So if you had an employee, for example, who worked 1,000 hours and you wanted to know what their FTE was, you would divide that by 2080 hours, because that's what the government considers a full-time equivalent. In that case, that person is 0.48 FTE. So again, in my example, you could have 10 people who work 30 hours a week, and that would equate to 7.5 FTEs. So an important concept, too, is that no employee can have more than 2080 hours. So, for example, lots of people work overtime. Regardless of how much overtime, if they're a full-time employee, works 40 hours a week, they're one FTE and they're counted as 2080. Okay? So, back to if you have fewer, this is the first category, if you have fewer than 25 people. And so in terms of the credits that are available, if you have less than 25 FTEs and the average annual wages, if you add them all up and divide it by the total FTEs, is below 50,000, okay, and the employer contributes 50%, at least 50% or more, towards the employee's self-only health insurance premiums. Now, important consideration here is that owners and family members are not counted as FTEs. Those people will go on to the exchanges, which open October 1st in a couple weeks, and they will be able to purchase insurance that way as an individual. But they're not counted as employees for this small business credit that's available. So again, if you have less than 25 FTEs, then your business can get a small business tax credit. Now, in 2013, it's 35%. In 2014, it's 50%. Now, what's important to note here is that this tax credit works on a slide-in scale. So if you're a company that has fewer than 10 employees and you pay your employees on an average of $25,000 or less, you're going to get the total 50% in 2014. So say you have 12 employees and the average wage is $30,000. Well, you're not going to get the full 50%. That is going to be reduced to take into consideration that you have more than 10 and exceed the 25,000. So that's the maximum you can get. There's a new program out called SHOP. It's a Small Business Health Options Program. And what it is they call it an insurance marketplace. You go on a website, and I do have the website on here. So it's at the end of the presentation. You go on to this website, and it's a place for small businesses to purchase health insurance. And what's nice about it is you get to pool your risk with other small businesses, and your premiums should be that comparable to a large business. Okay, so now we're in the next category, and the next category is below 50. So from 25, more than 25 and up to 50, you can also use the SHOP, the website, to go in and purchase health insurance. You're not required, this was recently changed, you're not required to offer health care coverage to employees in 2014, okay? And the nice thing about once you enroll in SHOP, your business can continue to grow. If your business continues to grow, you can stay in SHOP. You don't have to, you don't have to, say you get over 100 employees or FTEs, you don't have to get out of SHOP. So here's where it gets a little complicated and costly. And that's when you have 50 or more employees. It's 50 or more FTEs. It says employees, but it's FTEs. So that could be 75 employees. And the statistics say that only 4% of businesses fall in this category that have 50 or more FTEs. But beginning in 2015, for those businesses that do not offer health insurance, affordable health insurance, they may be required to pay a penalty, what's called the employer shared responsibility. And so, again, that's in 2015. And so if at least one of your full-time employees, and this is interesting, for the penalty, it's a full-time employee is 30 hours a week. But in our example previously, when you're counting the number of employees you have to determine your FTEs, it's 40 hours a week. But when you're looking at the penalty, you use 30 hours a week, which is an important consideration. So if one of your full-time employees, 30 hours a week, can go on to the exchange and purchase health insurance on their own and get what's called a tax credit, what they're calling a premium tax credit. So say, for example, I make $10 an hour, and I work 30 hours a week. So that means I make $15,600 annually. If I go on the website and the exchanges and I purchase health insurance with that kind of salary, I will be eligible for a premium tax credit. And the individuals who are eligible for premium tax credits are those up to 400% of federal poverty limits. So that's not just a $10 hour employee, that can be a 20-hour $20 an hour employee who works 30 hours a week is eligible for a premium tax credit if the employer does not offer it. So there's lots of rules with this. So that's one of the first ones. And again, 30 hours a week. So if an employer, as an employer, if you have more than 50 FTEs, there's two scenarios that could cause you to have to pay this penalty. One is you don't offer health insurance to at least 95% of your employees, full-time employees. That's a real important, full-time employees. So again, full-time employees are considered anybody 30 hours or more. Or the coverage offered to employers, full-time employee is not affordable or minimum value. So it's saying the insurance that is offered is not affordable or does not provide minimum value, and we'll look at the definition of those two terms. And, so either and, at least what we talked about a little while ago, one full-time employee, 30 hours a week, can go on the exchange, purchase health insurance, and get a premium tax credit. So in terms of affordable and minimum value, what's considered unaffordable is if a full-time employee's share is more than 9.5% of his or her annual salary. So when I looked at the employee who made $10 an hour, 30 hours a week, I determined that if this employee's cost for what's offered by the employer, if that employee's cost is $124 a month, then that's more than 9.5% of his or her salary. Okay, so that would be considered unaffordable. The second concept is minimum value. This is a little easier to understand. And this just says that the plan must cover, on average, 60% of the plan's cost. So if you're paying 50%, that would be considered not minimum value. It has to be 60%. So that's important consideration. So what are the penalties? Well, there's two scenarios for penalties. The first scenario is, let's say you don't offer coverage to at least 95% of the full-time employees. Then that means that you're going to have to pay $2,000 per year times the number of full-time employees minus 30. So if you have 50 employees, you subtract a 30, it's 20. And then 20 times 2,000, that would be a $40,000 penalty you would pay. Now, it's calculated on a monthly basis, and things can change on a monthly basis. Some people have it, some people don't. So that's just kind of a big picture scenario, looking at it on an annual basis, but it is based on a monthly calculation. The other type of penalty is if it's not affordable or meet minimum value. So then that's $3,000 per year per full-time employee who receives a premium tax credit on the marketplace. So if you have 10 employees who go out and purchase health insurance on the exchange and get a premium tax credit, then you would pay $3,000 times 10. And again, that's calculated on a monthly basis. I know it gets very complicated. Now, the good news is this payment, though, cannot exceed the payment that you would be eligible or required to pay in the first scenario. So you have to look at both scenarios, and the lower of the two you pay, or can't exceed the first one. So there's some other key issues with this penalty, what's called employer share responsibility. So an employer is not eligible for for non-coverage to part-time employees. So if an employee works on average 28 hours a week, there is no, even if they go on the marketplace and purchase health insurance, they get a premium tax credit, you're not, you're not penalized for that. This is anybody who's 30 hours or more. If you offer affordable health care coverage and that individual, an employee declines it, you're not responsible for that either. And then employees also can get coverage through other means, through spouses, through Medicaid, various other programs. To avoid payment, employers that offer coverage to full-time employees must also offer coverage to dependents. And dependents are children under 26. Doesn't need to be offered to spouses. Couple notes that are important key considerations is that the cost of providing the coverage is tax deductible. Okay, that's good. The employer shared responsibility payment, that penalty is not. In terms of a sole proprietor, this is just like in the example what we talked about with a business that had less than 25 employees but couldn't count the owners. Sole proprietors, like owners of businesses like that, they'll just be able to purchase their coverage on the individual market place, which actually you can start enrolling in on October 1st, 2013. And it is pretty easy to use, and if you use the web. I haven't tried Callin and some of the other, they're having what's called Navigators that'll be set up in various places in the community, and these people will enroll individuals in these healthcare insurance products. And so in terms of the internet or the web, it's not too bad. This is just some information. In order to, these insurance companies who are offering these health insurance plans, they are required to include all 10 categories. So these are very good health insurance policies because it includes everything from hospitalization, mental health, prescription drugs, preventive services, labs. So it really is very comprehensive what the healthcare provider or the insurance companies have to provide. And also there's various levels of coverage, just like there is today with most businesses. You can get the cheapest one or you can get the platinum, and they've called them bronze, silver, gold, and platinum. Platinum being the best, that means it pays for most everything, and that the enrollee, the individual will pay less. Of course, that plan costs more. So again, the website that one would go to for the shop or to enroll in the exchanges is the healthcare.gov. And also there's what's called the subsidy calculator. And that website there is for if you want to determine what your subsidy would be. Okay, and questions? I know it's a lot of material and I went through it really fast. Yes?
And this coverage, does anything here cover dental insurance at all?
No. There actually, I might have something about the dental. For pediatric, sometimes, but not for adults, no dental. That's a good question. Yes?
That slide isn't in our package.
Okay, that's right. Those are two slides I put on at the very last moment, so I'll make sure you get those. The two slides that show this slide here and this slide there. Make sure you get those. Yeah. Yep.
In theory, this is a really great thing. However, it seems to put the onus of wellness on the doctors providing the care as opposed to putting the onus on the person who's not compliant. So a doctor who's got a diabetic patient who doesn't eat right and doesn't take their meds and has to be re-hospitalized, the doctor and the hospital aren't going to get reimbursed, but that person who's not compliant is not going to be penalized. So it seems a little bit skewed and a little hard to manage, because how can you manage it? Like you said, it's like herding cats.
Right. Well, and that's a good point, and I didn't bring it up, but when an individual goes on the exchanges to purchase health insurance, they ask questions like, how old are you? Do you smoke? And if you answer yes, for example, that you smoke, your costs will increase. So there will be costs for some lifestyle choices, additional costs, but in terms of if you're not compliant, for example, you're a diabetic, and you don't take your insulin and you're not compliant, yeah.
Well, it's kind of funny, because this sounds terrible to say, but it's almost as though the coverage for the recipient should be based on their compliance. So say, for example, I'm a diabetic and I decide I don't even care, I'm not going to take my insulin, I'm going to eat whatever I want, and I end up in the hospital 3 times a month. Well, after the second or third hospitalization, my coverage should be less so that my pocketbook suffers, which is going to cause me to be more compliant.
It's a good point.
And that sounds kind of archaic, but in some respects, we have to take ownership of our wellness. And I'm somebody who takes no medication, and I believe in taking charge of my health. So everyone else is being penalized and having to pay higher premiums for people who don't really care. So it's a little bit frustrating.
Yeah, and I see that, and hopefully down the, in the future, there will be some adjustments made for that, for those of us who choose to eat healthy and do the right thing.
I was just going to say, add that the doctors are being penalized for preventive health. So that, just to make sure.
Yeah, and some of it has to do with, people they're showing up in the emergency room when they're having, a serious problem. If they had gotten to their physician prior to that and they were on proper medication, or somebody was following up on them, the thought is that they wouldn't end up in the emergency room. So by managing the patient better, but yeah, you absolutely need to have some responsibility.
Could you compare that to the number of people who currently are using the emergency room for their primary care and cost of that?
I don't know in terms of nationwide or in Brevard County. Like I said, the Space Coast Health Foundation was formerly Wusthof Hospital System or Health System, and there's plenty of people that did use the ER as their primary care, and people without health insurance. And so what happens is you don't get paid. The hospital does not get paid for those visits. So who pays for it? Well, eventually, in the case of Wusthof, it was sold. But who pays for it is the taxpayers eventually. So the thought is somehow to keep people out of the ER and manage their health.
Just to show how this is not that much different than what we're already experiencing.
I see. Because, well, in terms of the cost of the ER, that's the most expensive health care. It's a lot cheaper to see somebody outpatient in a physician practice, for example, or in a community health center, for example, compared to a hospital, where it's the most expensive place to see a patient.
I have another question as it relates to the exchange of medical information between practitioners and hospital organizations. There is notification. So if someone goes to, say for example, they go to their primary care doctor who orders an MRI from a local imaging center, and then they go to a specialist who doesn't really, I don't know, for whatever reason, doesn't really think that they do quality imaging, or they don't work with them, or they can't pull the imaging up online, and they say, no, I don't really like this MRI, you have to have it done again. So there's extra cost being incurred because of the lack of communication, and it seems to me, it seems to me that should be mandated, that there should be open medical communication, that if I have a health condition, any doctor anywhere in the country can access my medical records and say, yep, I see what you've already had done. And that's not happening, which is increasing costs to insurance companies. It's increasing cost to Medicare. Mm-hmm. And that really is kind of the crux of a lot of this, that really should be addressed. And do you see on the horizon that happens?
Yes, most of your physician practices and hospitals, up until as of 2014, if they didn't get an electronic health record that could communicate with all types of providers, then they're going to be penalized. Their reimbursements will be reduced. So they first got the carrot. We'll give you money if you do it. We'll help you pay for it. And then in 2014, it's to stick. Okay, you didn't do it, we're going to cut your reimbursements. So there was that incentive since it started, I think, in 2010, really, to 2014 to ensure every doctor's office, every hospital, lab, x-ray imaging, all providers have electronic health records that communicate. Part of this initiative is to have accountable care organizations. So for example, in Brevard County, you may have somebody like Health First that has a big group of doctors, and then they have specialists, and they have hospitals, and they have home health, and they have skilled nursing facilities, they have labs, they have all these types of services that patients would need. They all will communicate with each other, because if you did a x-ray on a knee a month ago and then you get the x-ray again in another month, they're not going to get paid for it. So the healthcare organizations are going to be penalized or incentivized to comply with the electronic health records.
But my understanding is that they don't talk to one another. Health First doesn't talk to Wusthof, who doesn't talk to the independent doctors. That's where the disconnect is. That's what I was referring to, because I know the big health organizations,
Yes.
they're all connected into the same network, but what about everybody else? Again, there's the lack of communication, and my understanding is that in order to open up that portal of information, these independent doctors have to pay a huge fee that they can't afford to pay. So again, I think that there's the playing field for information access should be leveled and not be so cost prohibitive to the provider that they can't do it.
Absolutely. It's very important that everybody have access to not just your physician, but also yourself. You have access to your records so that you can advocate for yourself. I know a woman back here had her hand up. I'm sorry.
My question was just, do you know, one thing I hear a lot about is the doctor shortage. I mean, in theory, we're going to reduce people going to the emergency rooms, but I'm like $91,000 or 91,000 doctors short, like in Central Florida. So what's being done to address that, and is that true?
There definitely is a shortage of primary care doctors, not specialists, not the cardiologists, the folks who make the big dollars, the pediatricians, the family practice, internal med docs. There is a shortage of that, and I recently read that they're expanded the program that allows physicians to basically, the government will pay back their loan if they go to work in these areas, these designated areas where there's a physician shortage, or areas where there's a real low-income areas. If you'll work in these communities for 3 to 5 years, they'll help pay off your loans. And for example, you have a community health center here in Brevard County, Brevard Health Alliance, that sees a lot of Medicaid patients and uninsured patients, and they have physicians there that go to work for them, and if they make a commitment to work there, it's either 3 or 5 years, their loans are paid back. So that's one program that I know has been expanded, but there certainly is an issue with that. This gentleman has your hand up.
Yeah, I was just going to comment on your previous discussion about sharing information. I wrote a white paper about the use of sharing cloud-based technology with radiology imaging, but one of the things that came up, of course, is HIPAA and electronic privacy, so that has to be a consideration too. But my real question was, you mentioned about that Florida opted out, so the Medicaid is not being expanded, but how has that affected any other thing, like with the exchanges of the healthcare, affordable healthcare? Is that any other effects that Florida's opted out has taken place? What are we feeling?
So if everybody didn't hear that question, let me just rephrase it. I brought up earlier that Florida was one of the few states in the country that chose not to expand Medicaid. Though I will say that the governor, I think it was a few months ago, did say, yes, he thinks it would be a good idea and will vote in that direction. It's just now it's up to the House and Senate to support that. What that means is, for example, when you go on to the exchanges, Florida does not have their own exchange. You use the federal government's exchange. So a lot of states have their own exchanges. So Florida doesn't have one. So you'll have to go on the federal government's exchange. And the big issue with it is let's say you're one of those individuals, and when we looked at the slide with all the people, you're out of the 18 million, or 18% of people that don't have health insurance, the vast majority of them, those in blue, 51% would be eligible for Medicaid. Okay, but because Florida did not expand Medicaid, what that means is these folks will have to go on the exchange and purchase it. Now, they'll get a subsidy. They won't have to pay the full price, but they'll have to pay something. So, my take on that is that it probably won't happen like it's supposed to happen, that this whole 51% of the population is living just so marginally that even if it costs them $10 a week, they don't have it, so they're not going to purchase it. So I think Florida's just going to lag in terms of the rest of the country in terms of our, our costs, because these folks will still end up in the ER. Any other questions? Yeah.
So people who are veterans who are using veteran assistance for health care do not have to acquire the health insurance as opposed to with the Affordable Care Act, because if they're already using veteran assistance or veterans hospitals assistance medical care, they don't have to acquire. Is that a true statement?
I did some research on it, and I was not able to find any information. I actually contacted the Small Business Association, who was doing all kinds of webinars on healthcare, the Affordable Care Act and small businesses, and sent them emails to ask them, how does this work for veterans? And I didn't. It looks like somebody might know the answer.
Jim Brooks from the Small Business Administration. If you are under a veterans plan, Tricare or something, that is your health plan. That is your health plan, so you are covered. You do not have to go out on exchanges.
Could you repeat the answer for the...
Sure. The question, Don.
If you're currently under Tricare, you have some government-sponsored health care coverage, you don't have to go out to the exchanges. That's your coverage.
And that same if you're on Medicaid, if you're over 65, a lot of old people think that they have to go to the exchanges because we're going into the open period right now, and so there's some confusion out there. So that's just the other one. There's some confusion.
Did you want to say something?
One people want to add to that, I was at a veterans conference in St. Louis a while back, and one of the points that was made, this whole hire veteran initiative, this movement, is because veterans with Tricare, you don't have to do that with these people. So it makes veterans employees a lot more attractive, as well as everything else, because they're exempt from this.
Why is that?
They have Tricare, they don't have to do it.
They have their own insurance, so the company doesn't have to pay for it.
Right.
Yeah, in one of the slides we looked at, the employer who would have a penalty if an employee did not have coverage, that penalty is not applicable if the individual has coverage through some other mechanism, which could be Medicaid, it could be Tricare, a government-sponsored plan, Medicare. So that's not, they fall out of the penalty.
What if I skydive and drive a smart car on I-4? Is that fair to other people who don't?
I'm
Are you wearing a seatbelt?
I'll call your wife.
was there a gentleman in the back who raised his hand?
No, sir. Your question was about the personnel that use VA clinic. It wasn't a question on Tricare, correct?
Yeah, clinics, yeah.
VA clinic is totally different than Tricare.
Yeah, but it's a veteran health policy that you're covered under.
Yeah,
right?
but it's totally different than the VA clinic. If I'm in Tricare, I go to the base and I'm care match. What he was speaking of is the veterans that do not have insurance. They go, I think, that go to the VA clinic for low-cost medical care. It's totally different. When we receive a letter, all the vets that do that, because I got both, we receive a letter from the VA requesting information from us so that we clarify what insurance we have, what insurance we don't have. So person that has been going to the VA clinic has received a letter from the VA clinic, I hear, not from the VA clinic, but from another VA center, for them to clarify what insurance they have and what they do not have, and how much money they make also. So VA is also lining up with that same affordable health care.
Okay, now are you receiving your medical care through the VA? Okay, Tricare? Okay, if you're under Tricare, you do not have to go to the Affordable Care Act market shops. You have your coverage. The only thing that you may want to take a look at is under Tricare, your children. You know, you have to pay that premium for the children above the age of 21 if they're not in college anymore. And that's a cost consideration because now your child, let's say they're between the ages of 21 and 26 years of age, while they can fall under Tricare, and I want to say it's like $200 or $300 a month. Yeah, you may find it cheaper to insure them under the marketplace, but I don't know those prices. You'll have to wait till that comes out. Oh, I'm Jim Brooks from the Small Business Administration. Also, just other things, I know you mentioned the free webinars. If you go to our website, sba.gov/South Florida, go to our events calendar. I know we have probably more than a half a dozen webinars coming up with the state of Florida and Small Business Majority that go over this whole Affordable Care Act again. And it's really important for the small business owners to understand what the impacts are. I think you did a great job talking about what the impacts are. But at the same time, you guys have employees. Well, what are those employees? You know, by October 1st, you're supposed to have a signed sheet of paper for every employee explaining the Affordable Health Care Act. You can find a copy of that letter on the Department of Labor's website, and whether you have more than 50 employees or less than 50 employees. But that's just to inform them about the Affordable Care Act and the individual mandate. They have to have health care insurance on their own. If you're not providing it, guess what? They still have to go out and get it, and then there's the individual mandate for that.
Okay, well, we're just about out of time. I owe everybody 2 slides. I added 2 slides at the end, and I'll make sure I get those to Rob. And also on the PowerPoint copy that you have, my email address is there and my contact information is there. Please feel free to contact me with any questions. And thank you.